IVF and Sex Selection.
What is IVF? In vitro fertilization. IVF is the original test tube baby technique. It was developed over 30 years ago for the treatment of women with damaged fallopian tubes and remains an important factor for pregnancy methods. IVF is not the first step for infertility, though. It's reserved for severe cases when methods like fertility drugs, surgery, and artificial insemination come into the works, but if they don't play out how they were supposed to. It works by combining eggs and sperm outside the body in a laboratory. Once the embryos are formed, they are placed in the uterus for fertilization. The treatment starts with hormone therapy to stimulate the development of follicles in the ovary. Hormones are ejected in a female's body to help produce multiple eggs a month and not just one. Timing like a regular pregnancy is vital, and if the eggs are retrieved from the follicles too early or too late, they will cease to develop normally. After this, they are collected and fertilized in a test tube to create several embryos. They sit in an incubator for 2 to 5 days to complete development. 1, 2, or even 3 embryos are then transferred through the vagina into the uterus for completion. Once placed inside the woman, they are deemed bed rest and discharged shortly after. Like any method people use to get pregnant, it isn't guaranteed that the eggs will be fertilized to have a baby. It's the same concept with IVF, so after 2 weeks the doctors give the patients a pregnancy test. If the end result comes out with no baby, surplus embryos are used once again. These are frozen eggs that the doctors save for non-successful operation. Freezing eggs is essential to the IVF process, and because of this, the pregnancy rates with IVF in 2009 was 29.4 of women, ranging higher or lower depending on the woman's age.
Why is IVF of interest? The U.S. has no restrictions on IVF for sex selection. IVF is most prevalent among middle and upper class families with at least one child, and patients are typically 30 years or older. But in spite of all of its availability, the use of sex selection is actually pretty low. This might be because of its high price tag. IVF with PGD costs anywhere from $15,000 to $25,000 per cycle. Judith Thar, who's a professor of law at Whittier Law School, says the number of patients, and particularly the number of offspring that are born following IVF and PGD for non-medical reasons, are actually pretty low. In 2008, a study from Johns Hopkins University provided a glimpse of how common IVF with PGD is. Their study found that 42% of clinics offering these procedures reported providing sex selection for non-medical reasons at all. In earlier surveys found that only 8% of people who responded said they would even use IVF or another technology to choose the sex of their embryo for non-medical reasons. And of course, social concerns have arisen. Many people see IVF sex selection as discrimination against one sex or the other. Around 41% of clinics limit the use of non-medical IVF to parents who already have at least one child, according to a Johns Hopkins study, to avoid discrimination. The U.S. is one of the few countries in the world that still legally allow PGD for prenatal sex selection, and approximately 4,000 to 6,000 procedures are done each year. Statistics on gender selection are pretty rare. Many women who undergo PGD for gender selection discovered the procedure in an online forum. Women are paying huge sums to have daughters rather than a son in the U.S. It is illegal for use for non-medical reasons in Canada, the UK, and Australia.
A process by the name of PGD, pre-implantation genetic diagnosis, sometimes referred to as PGS, is the only method that will guarantee sex selection. The process involves fertilizing the mother's eggs with the father's sperm in a lab. After a few days, the eggs undergo a procedure to determine if they have male or female chromosomes. The egg with the desired sex is then implanted in the mother's uterus. This procedure does not have any negative effects on the baby. However, some clinics flat out refuse to offer PGD to couples who solely want to select the sex of their baby. But in recent news, it was reported by singer John Legend and his model wife Chrissy Teigen that they actually selected the sex of their baby. We know that PGD is highly effective with a success rate of 97 to 99%, and we know that PGD is costly with procedures ranging in upwards to $25,000.
As the popularity of IVF increased over the years, new controversies came along with them. IVF is a tedious and time-consuming procedure for both couple and doctors, but if the procedure is a success, the couple will develop a healthy child like any normal expecting parents. IVF is indeed a helpful source of infertility, but some fear that it is upsetting a natural process, especially now that the treatment has enabled couples to not only create new life, but gain the ability to choose the gender. IVF is just a procedure and does not reveal anything about gender on its own, but now that the procedure has improved over the last 20 years, couples have gained the ability to add a screening step to the cycle that evidently determines a lot about the embryo, including gender. Most people believe that this procedure will create a bias of gender, choosing more boys over girls. Manipulating the embryo for the screening will put it at risk and can divert resources away from medically necessary IVF treatments. As previously said in the video, model Chrissy Teigen and husband John Legend have recently come under fire for pursuing this procedure because of these controversies and concerns, which made sex selection IVF more popular than ever before. Currently, federal laws have made it known that these facilities have to report their success rates, but clients' reasons for using these treatments are not included in these reports. A number of countries, such as the UK and Canada, have put a ban on sex selection for social uses, except for when it is necessary to avoid the risk of sex-linked diseases. All in all, the process of sex selection is here to stay.